Hello, I'm Carrie Wybrew. I'm your Dean of Nursing for Concord Career College's Practical and Vocational Nursing programs. And I want to congratulate you all, class of 2018. You are the future of nursing. In 2011, the Institute of Medicine published The Future of Nursing, Leading Change and Advancing Health. It recommended healthcare education to match the transformation occurring in U.S. healthcare, both in terms of the care environment and the practice that clinicians follow to achieve improved outcomes. The Institute of Medicine report emphasized the need for equally profound changes in the education of nurses, both before and after they receive their licenses. Because nursing is one of the many professions that is changing rapidly in terms of complexity and the technology involved, this report emphasizes that creating an expectation and culture of lifelong learning for nurses is therefore essential. Not only must you be humble and flexible enough to move beyond stereotypes in caring for each patient, but also now you have an accountability for lifelong learning to foster improved nursing practice and patient safety. What is lifelong learning? Ongoing, voluntary, and self-motivated pursuit of knowledge for either personal or professional reasons. It not only enhances social inclusion, active citizenship, and personal development, but also self-sustainability, as well as competitiveness and employability. Lifelong learning involves seeking and appreciating new worlds or ideas to gain a new perspective, as well as questioning one's own environment, knowledge, skills, and interactions. The most essential characteristics of a lifelong learner are reflection, questioning, enjoying learning, understanding the dynamic nature of knowledge, and engaging in learning by actively seeking learning opportunities. Keeping the mind active is essential to both lifelong learning and being able to translate knowledge into the capacity to deliver high-quality nursing care. How could lifelong learning benefit patients and outcomes? Nearly 70% of the healthcare workforce is involved in direct patient care. If each of those healthcare professionals could prevent harm or death for only 5 people in their lifetime, as a result of the acquired knowledge, over 15 million lives could be saved. Recall the reasons that made you choose to become a nurse. Know that you have days where you will question why you made this choice. I recommend, if you haven't already, that you keep a box of memoirs and notes you receive as a nurse. I look forward to watching what each of you will do in your nursing career, and challenge each of you to prepare and enable nurses to lead change and advance health for all.